my name is Morgan. I'm here with Katie. Last time I did her half assessment. This is her full assessment. I'll start from her head and move down to her feet. When she walked in, I was able to assess her gait. She was not disheveled at all. She has normal gait. Also, she is dressed appropriately for the season, and she has the correct mood. She's appropriate. First, I'll start with her head, but through my entire assessment, I will be assessing her skin to see if there's any bruising or skin issues that I should note in my assessment as well. I'm going to start with her head. I'm going to massage and see if I can feel any nodules or bumps. I do not feel any of those. Anything that I would note, I would further examine those. Next, I'm going to move down to her temporal artery, and I'm going to palpate those. They are 2+. Next thing I'm going to do is assess her temporal mandibular joint and have her open her mouth and then close, which is good. Next thing I'm going to move to is her eyes. One of the things that you can assess for, we will not do that here, but she could do a Snellen chart, and she would stand 20 feet away and she would read the lowest line that she can read. And she has done that before because she does wear contacts. So, and you have contacts in now, don't you?
Yes.
Okay. Next thing I'm going to do is just look at her eyes, see if I see anything that I need to note as well. I'm going to look at them with my light here. I'm going to shine a light in your eyes, okay? I'm going to check for accommodation and see if her pupils are reactive to light. Just stare right at my nose, please. And they are Perla. Next, I'm going to check her accommodation. I'm going to have her stare at the wall, and then I'm going to put my pin in her face and have her stare at that, and also check for her eyes as well. Okay, look at my pin. Now back at the wall. Look at my pin. Now back at the wall. Oh, sorry. It's okay. Okay, and they are Perla. Next thing I'm going to do is check her peripheral vision and the cardinal directions to see if those are good as well. I'm going to put my hands behind you and you tell me when you see my hands, okay? There. 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 I didn't know where else to go. Okay. That was great. And then next I'm going to do the cardinal directions. Just stare at my finger and just stare at it. Okay. That's all I want you to do. And that was great too. Next thing I'm going to do is her ears. Right now I can tell that she can hear me well. She does not wear any hearing aids or anything like that. I'm going to inspect her ears, and I'm going to check her temporal membrane to see if it is pearly white. Sorry, I'm short. Okay, and that is pearly white. And that is also pearly white. And her ears are normal structure. I don't see any disformities or anything like that. Next thing I'm going to do is the whisper test. I'm going to whisper words to her, and I'm going to have her repeat them when she hears them. Okay? Does that make sense?
Yeah.
Okay, I got you. Ready?
Baseball.
Okay.
Apple.
Okay. And that was great. So, next thing I'm going to move down to is her mouth. One of the things is I'm going to inspect it and check some of her some of her cranial nerves as well. 2 of those are 9 and 10, and I will do my tongue depressor with that. I probably should have got bigger gloves. I have little hands. I'm going to have you open your mouth. Inside I can see that there are no lesions or anything like that. It is moist and it's pink. I can look at her uvula back there and check her gag reflex. Sorry. You're fine. Okay. And I can see that that is okay. I can have her stick out her tongue as well, see if there's any problems with that. Also, I can have her open her mouth and say "aw." Okay. And everything looks good. That would be it on her mouth. Also, you look at her palate, make sure there's no lesions as well up there, and there wasn't. Next, I'm going to move down to her neck. I'm going to palpate her trachea and her lymph nodes to see if there's any swelling. I can tell that her trachea is midline. It is not shifting at all. There's no shift. Also, her lymph nodes are soft and movable. There's no swollen lymph nodes or anything like that. Also, I can palpate her trachea. She does not have, not trachea, her thyroid. She doesn't have any thyroid issues in her family, and she doesn't have any issues so far with that either. And you can feel that midline as well. Okay, also I'm going to check her carotid arteries too, on each side, and they are 2+. So that is great too. Next, her upper extremities, I can have her hold out her arms, push and pull against me.
Wait, am I pushing or?
I don't know,
Okay.
just pull or push. Okay, there. She has full range of motion with that as well, so her extremity, her joints are fine with that as well. Next, I'm going to move down to her heart and her lungs. First, I'm going to also take her lungs. There's 3 different tests that you can do for the lungs. I'm going to do the whisper pectoriloquy, only because I like to say that word. So I'm going to do that. I'm going to have her, every time I move my stethoscope, I'm going to, you have a hair on you, sorry. Starving me nuts. I'm going to have her whisper 99 to me every time I move my stethoscope, and I'm going to listen for the vibrations.
So it's for now, 90.
Yeah. Okay. And during that too, I could also assess for her lung sounds as well, and they were clear bilaterally. I would also take her front lungs, her anterior lung sounds as well, and I can do that after, while I'm doing her heart assessment as well. I'm going to listen to her heart. I'm going to start with the aortic valve, and then I'm going to move over to the pulmonic, then to the tricuspid, and then down to the mitral valve. And I'm going to listen to the mitral valve, which is her apical pulse, for 1 minute. Her apical pulse was 82. And there were no murmurs. I could hear it was normal sinus, so that's good. Next thing I'm going to do is I'm going to have her lay down, and I'm going to inspect her abdomen. Get all this stuff out of the way. Move all this. Okay. Alright, I'm going to have her first pull up her shirt, and I'm going to look at it visually first. I'm going to see that it is symmetrical. There are no lumps, any protrusions. She doesn't have a hernia or anything, and it's symmetrical. Next thing I'm going to do is I'm going to listen to her stomach. I'm going to start from the right lower quadrant and work my way around in a clockwise position. Sorry if that's cold, it's okay. audible and active in all quadrants. Next I'm going to palpate her liver, just to check for the borders of it. It's on the right side over here, and I feel it there. And then I'm going to palpate for her spleen, which you should not be able to feel it, and I don't, so that is good. Okay, is there any tenderness that you feel there at all? Okay, and that's it for that. You can sit back up, and we'll check your lower extremities. Also, when she walked in at the beginning, I was able to see that she is able to move correctly. Her gait was fine. So I'm going to check her range of motion. I'm going to have you bend your knees at the joints there, at your knee joints, up and down. Any tenderness at all?
No.
You have had knee surgery though, haven't you?
Yeah.
Okay, that's right. Okay, is there any tenderness when you do that?
Nope.
Okay. Next I'm going to have her dorsiflex, plantar flex, check her joints there too. And then I'll check her pulses, her pedal pulses, her dorsal pedal pulses. And that's that. Later good, 2+. Next I'm going to have her stand up. And during this assessment, I'm going to check her spine to see if she has any scoliosis noted or anything like that. Also, I'm going to check for her spine, and then also her Romberg test as well. Okay, I'm going to have you bend over. And I can tell that her spine is midline and there's no curvature to it. Okay, that's good. Next, I'm going to assess her Romberg test. And what she's going to do is she's going to raise one foot up, and she's going to close her eyes, and she's going to balance on one foot, and she's going to do this on each side. Yes, switch. And she does have a little bit of balance issues, but not a big deal. So, looks good. Okay, next I'm going to have her sit back down. I'm going to have her run her foot, her heel, from her knee down to her ankle. Okay? And that is noted to be good. I'm also going to ask her to, if she feels any numbness, do you feel numbness or tingling anywhere at all? She has normal sensation of that. The next thing I'll do is I'm going to check for her sensations of her areas. I'm going to use a Q-tip for that, and what I'm going to do is check to see if she can feel the softness or the dullness of the Q-tip. I'm just going to touch it in different places on you, and you tell me if it's dull or soft.
Okay.
Okay? And now I want you to close your eyes. Oh, sorry. I know. Cheater.
Dull. Soft.
Yeah.
Soft.
You almost said sharp.
I know.
Dull.
No.
Was it?
No.
Okay.
So-
Soft. Dull. Soft.
Okay. I have little issues with that, but that's good. Okay. And then I'm going to do her finger to nose test. I'm going to have her put her arms out wide, and I'm going to have her close her eyes and touch her nose. Okay, and that's good. And then the next thing I'm going to do is do her neck, move it up and down. Okay, check for range of motion and all that. Other than that, I think our test is done, and that's it. I'll ask her if she has any questions, and then she can come back if she has any problems or issues. Okay? Okay, thank you.